Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. First, the highlights. 3 doctors and 9 nurses test positive for COVID-19 in Taraba State. Kano State government tightens safety measures amidst increase in coronavirus cases. And the United States to sign 10 new executive orders to tackle COVID-19, which includes more testing and vaccines. Let's begin in Africa, where the second wave is pushing the fatality rate above the global average. According to the Africa Center for Disease Control Director John Kagesong, the continent-wide case fatality rate was now 2.5% above the global average of 2.2%. Africa has so far recorded around 3.3 million cases of COVID-19 and nearly 82,000 deaths. These figures represent small fractions of the global totals, but cases have increased by an average of 14% each week for the past month. It's an upward tick in Nigeria, with 14 deaths recorded in the last 24 hours. 1,386 new cases were confirmed. Till date, 114,691 cases have been confirmed. Over 90,000 cases have been discharged and recorded in 36 states and the Federal Capital Territory. Now, the new cases are reported from 21 states and the Federal Capital Territory, with Lagos, Rivers and the nation's capital in first, second and third place. We also have other states that have recorded some cases as well. The NCDC continues to appeal to everyone, to residents, to reduce the risk of spreading the virus by complying with the safety guidelines. We take you now to Taraba State, where 12 health workers comprising 3 doctors and 9 nurses have tested positive for COVID-19 at the Federal Medical Center, Jalingo, the Taraba State capital, confirming the incident shortly after an emergency meeting of the technical committee. The acting head of clinical services of the hospital says the medical personnel are responding to treatment. The state government has, however, ordered for compulsory wearing of face masks in public places to curtail further spread of the disease.
This year alone, FMC have gotten 19 cases of COVID. Out of the 19, 12, unfortunately, are for health workers. Among the health workers, 3 doctors and 9 nurses. None of them is dead. Most of them have been discharged home. Only a COVID patient is on admission now, which is not a staff. So basically, these are the statistics for FMC.
The committee noted that there's an increase in number of cases in the state, which cut across all the local government area, with the epicenter being the state capital. And in view of that, the committee is advocating that the populace should ensure the compulsory use of face masks in public places, in offices, in places of worship such as churches and mosques, and in schools, because the number of cases is rising, and if nothing is done, it may lead to a catastrophic end. That is why we're advocating that people should observe these basic protocols.
In the meantime, the governor of Kogi State, Herbal, has cautioned Nigerians against taking the COVID-19 vaccine, which is expected to be imported into the country soon, urging them to verify the product before taking. The governor stated this at Lokoja Township Stadium while speaking to citizens during the flag-off of the Special Public Work Program. He also asked Nigerians to scrutinize the vaccines well before they are injected.
We should not be deceived again. Enough is enough. We should tell them that they should keep their COVID-19 to themselves. We don't need that market in Nigeria. Vaccines have been produced in less than 1 year of COVID-19. no vaccine for HIV, malaria, for cancer, for headache, and for several other diseases that are killing us. We don't have vaccine. They want to use the vaccine to introduce the disease that will kill you and us. God forbid.
Officers and men of the Nigerian Army have been tasked on compliance with the COVID-19 protocols in order not to jeopardize the operations of the military. The Chief of Policy and Plan of the Army, Lieutenant General Lamidi Adeosun, gave the advice while delivering a speech by the Chief of Army Staff during the commissioning of some projects at the Nigerian Army Ordnance Corps in Lagos. He says this has become significant in view of the rising rates of COVID-19 infection in the country.
I have no doubt that the Corps will continue to grow in leaps and bounds under the direction and good leadership of the Corps Commander Ordnance. The world is facing a global crisis occasioned by the COVID-19 pandemic. This has brought about great changes to the way the Nigerian Army, like other responsible organizations, operate. These changes are necessary to protect you all from the scourge of the virus. It is therefore important to adhere strictly to all COVID-19 regulations and guidelines, as may be rolled out by the Federal Government Task Force on COVID-19. This is especially important as a breakout within the Nigerian Army will have serious implications considering the vital role the Nigerian Army plays in national security. I therefore urge you all to keep yourselves and your families safe.
The chairman of the COVID-19 task force in Imo State, Professor Maurice Iwu, has been speaking about the efforts of government in the wake of the second wave of COVID-19. And this is as schools in the state prepare to resume January the 25th, 2021. Our correspondent, Itope Kuteye, brings us more.
As Nigerians are still trying to come to terms with the emergence of the second wave of the coronavirus disease, the chairman of the COVID-19 task force in Imo State, Professor Maurice Iwu, is urging Imo indigents not to take for granted the precautionary measures earlier rolled out by the state government during the first wave. He says to a large extent, if these measures are being adhered to, it will go a long way to contain the spread of coronavirus disease in Imo State. Professor Iwu disclosed this in Owerri, the Imo State capital, during a meeting of the task force officials with members of the press.
We are borrowing from what others have done from China, particularly the Asian countries, and how they were able to do things differently, and they were able to survive this terrible pandemic. There are just three basic steps. You've had them before. They may be repetitive, but they are very essential. A, wear face masks whenever we are in public or in an enclosure with other people. B, maintain physical distance, that is keeping a reasonable distance between people. C, wash hands frequently with soap and water or hand sanitizers. If you don't have absolute necessity to go out, stay at home. And I don't need to re-emphasize that those people who are 65 years and older should not go anywhere at all, even if it is a burial.
According to the state government, all necessary protocols and measures are being put in place ahead of school resumption on Monday, the 25th January 2020. Itope Kuteye for COVID-19 updates.
Over in Kano State, the government has begun consultations on the possibility of fresh lockdowns due to the surge occasioned by a second wave of COVID-19 infections across the state. The governor, Abdullahi Ganduje, met with traditional rulers in the state capital.
With 2,636 confirmed cases, 289 active and 71 deaths, Kano is indeed racing towards difficult time at the moment. This meeting involving the state's 5 emirate councils is organized to obtain opinions from the traditional rulers on how best to prevent further infections across the states.
COVID-19 is getting tougher and tougher, and we have to be tougher and tougher as we did before. We have been mentioning that the issue of prevention, they say prevention is better than cure. We have to emphasize this aspect of prevention. We held a meeting with the security agencies, and we have designed a template where enforcement will be effective.
In order to achieve the desired results, the Deputy Governor in another event makes a passionate appeal to all citizens to take responsibility by obeying all NCDC protocols.
Definitely there is going to be that lockdown if needed be necessary. But now the markets are open, the parks are operating, so what do? We observe the protocol.
Sadly, Kano residents have so far not responded well to the call to observe NCDC protocols. For example, in most public places, particularly the markets, there has been poor compliance to coronavirus protocols, and this makes the renewed appeals of government very relevant at this point in time, as this may just help in improving compliance level of citizens in the states. Idris Jubrin, Channels Television News.
Our correspondent there, Idris, with that report. Well, joining us on the efforts of the Kano State government to curb the spread is the Deputy Governor himself, Mr. Nasiru Gawuna. We'd like to thank you for joining us on the program.
Thank you.
Your Excellency, let's begin. We understand that there are several bans in the state in the government's efforts to curtail the second wave of the virus. Are you hopeful that some of these measures, or all of them, can indeed reduce the virus infection?
Yes, the measures at the moment that has been taken, at the moment that we suspend all the event centers and the viewing centers, and then the civil servants have been asked to stay at home and work from home, and then this engagement of various stakeholders that will be happening from yesterday. I just came out from one of the meetings, that is a meeting with the market associations, and we're trying to sensitize them. One, we have gained experience when the first wave came in. In the beginning, there was a lot of panic and jittery, but later we took the challenge and we were able to contain the pandemic. And so we have learned so much with them, and a lot of people have suffered in this in the first wave. So other measures have not yet been taken. That is the measures of locking down the markets, locking down the state boundaries. It's not yet. But people have learned a lot. And the beautiful thing is, when we call these stakeholders, like the NURTW earlier this afternoon, they had already started producing the materials for the protocol of COVID-19. That is the masks, the sanitizing materials, and observing the desired protocols. And they agreed that if they disobey the law, they should be enforced and they should be punished and even prosecuted. So you see, I think these meetings that we are having at the moment is yielding fruitful results, and I think the curve will go down. Already before, the result was too high, but at the moment we are having lower results. We are at the bottom states, but before we are having higher results when the second wave hit. So I think our experience and the commitment of the people Even tomorrow, the ulamas have been sensitizers, the imams of the Friday mosque. They are going to do that, and very soon the clerics too, the Christian associations, we are going to have the same meetings with them so that they can go into the churches and now just reaffirm what we have done in the first wave. And I think, inshallah, we are going to be able to contain it like we contained it in the first wave.
So, Deputy Governor, you've spoken about protecting lives, especially with the public health concern. We'll talk about livelihood, and that is when we go on this very short break. Also more on what other states are doing to stem the second wave of the virus. Please stay with us. Welcome back to the program, and we've been speaking with the Deputy Governor of Kano State, Mr. Nasir Gawuna, on some of the state's efforts to reducing the second wave of the virus. Thank you for your patience. Looking at what you've said, several of the things that you've put in place for this, the ban on activities of clubs, concerts, and several other small, large gatherings, this will definitely bring some financial losses to these small businesses. And looking at those that might be out of job this period, what is the government doing? What are you doing to ameliorate, to cushion the effect of some of these measures?
What we did in the first wave, we took three cardinals. That is the issue of the preventive, curative, and the palliative. We are doing the same thing now. But each one comes after another. You do the preventive. If you are able to prevent it completely, there is no use for the curative. But if it happens, then you use the curatives. The curatives, from there, you will now go to a lot of enforcement that are going to be done. We just started the enforcement. We have not done the most tough ones in the enforcement. The top ones is closing the markets, closing activities, maybe even enforcing a curfew. But we have not come to that. When you come to that, that is when you find out a lot of people that are vulnerable will be at home without food. Then the palliatives will come in. But at the moment, the palliative is also being arranged. That is in case we don't know what may happen. We may have to force that. So the state government at the moment is planning on both the curative and the palliatives. Right now, the number of patients we have are not so much in our isolation centers, but we have isolation centers that have capacity of up to 600 to 700 people at the moment without no patient in there. So we have to prepare for that. And that is why the state is also preparing with funds that are going to be set aside in case of the vulnerables when we have to close down the state. But we are not hoping for that because, as I said, our number is getting down in Kano. Anybody that follows the trend will now see that the number of the positive cases is going down and our testing is increasing. Because all our testing centers, we have about 5 in the state. They are all very active, and we have even started community sampling, where we will sample it and bring it down to the testing centers, and they will be tested. So, God's willing, I don't think we'll have so much problem, but even the palliative side...
We'd like to appreciate your time. Lots of optimism there that you have. We appreciate your time on this. Thank you, Deputy Governor of Kano State, Mr. Nasir Gawuna. Thank you for joining us on the program. Now, 4 months after some practitioners of phytomedicine in Nigeria submitted 58 claims of herbal solution to the coronavirus, the Minister of State for Health is inaugurating an expert committee to screen all the claims for the cure of COVID-19 and other diseases. Speaking at the inauguration ceremony in Abuja, the Minister of State for Health notes that the committee will help government screen all the claims with a view to identifying those products that need to be forwarded for further evaluation with NAFDAC.
A total number of 58 practitioners made submissions on remedies for COVID-19. One of the outcomes of the interaction of that day was that the ministry will put in place modalities for facilitating the evaluation of the claims by National Agency for Food and Drug Administration Control and necessary clinical trials. This informed the need to constitute a standing expert committee to screen these claims, identify products that will be recommended for further evaluation by NAFDAC, and plan for the appropriate clinical trials. It is our desire to support these claimants in the process of evaluating their products with a view to finding local solutions to the menace of COVID-19 and other ailments.
Professor Adebayo Titoloju is the Managing Director, Unilag Consult. He joins us via Zoom now. I would like to thank you for joining us on the program. My first question to you is, since reopening, what's your assessment of how the second wave is affecting higher education in Nigeria?
Thank you so much for having me. There is no doubt that this second wave is really more active than the first one. What we have noticed now is that, particularly from our own campus, at least we now know 1 or 2 people that have died as a result of this infection. And this has brought a lot of attention to COVID-19, and everybody on campus now, we're now a lot more careful about what to do right now. Thank you.
So universities, college campuses are places where students live and study, close proximity to each other. Surely it will be trying times for an ecosystem now impacted by COVID. Tell us a bit more about the switching classes to online learning or blended learning. What challenges do you expect to encounter?
Okay, there's no doubt that we have no other option, at least as of now, but to have almost 100% online learning in most of our campuses, and where that is not possible, maybe because of some kind of poor infrastructure, there's some form of blended learning will have to take place. Currently, the challenges are numerous, but the authorities are putting in place the necessary measures, starting with, first of all, ensuring that there's a policy in place guiding online learning in the university. Though some of the universities already have some distance learning units, so they will definitely be thriving on some of these ones. And then with the policy in place, the adoption of virtual learning platforms have taken place. Particularly here, we have adopted some a VLE, a virtual learning environment, the module to utilize, and then training is currently ongoing. But the challenges will come along the line. The students will have challenges at home, particularly when it comes to data and the issues of electricity. And this will also be happening on campus as well. But there are efforts being put in place to make data available in some instances, even for students and also for lecturers. And the training are also ongoing. Then there is also the development whereby we are setting up a virtual learning technical units in the university to ensure that most of the materials that are being developed are ensured are up to the standard which will enable very good learning to be taking place. Thank you.
Much, Professor Adebayo Titoloju, MD in La Consult. Thank you for joining us on the program. Now, the world is 3 million people away from hitting the 100 million mark of COVID-19 cases, with the number in the U.S. still the highest in the world, over at nearly 25 million. Sadly, more than 2 million people have died from the disease. Countries are still looking to vaccines to help curb the spread of the global pandemic. For the UK, 5 million people in the country have received them. Older people of 60 years and above have high risk of complications from COVID-19 infections, especially those with underlying health conditions. Don't forget to take responsibility. You can see more updates on our website. That's channelstv.com. You can find more stories there, also on politics, business, and sports. That's the program this evening. Thank you for watching. I'm Minister Antoine Walker. Stay safe.